When you have diabetes, you may be prescribed insulin to help reach your blood glucose goals. It may make you nervous at first.
The thought of injecting myself with a needle was terrifying.
But your diabetes care team is there to help.
Now I seem like a pro at it. It's really not too difficult. It's just part of the routine.
With time and practice, you will gain the confidence you need to manage your diabetes. You can take insulin using a syringe, an insulin pen, or an insulin pump. Because insulin pumps require individual instruction, this program will focus on using a syringe for a single or mixed dose injection and using an insulin pen. Insulin syringes are easier to use than ever before. Their needles are small and sharp to help reduce the pain of injection. Let's look more closely at the syringe. The barrel holds the insulin. The insulin user pushes the plunger to push the insulin out, and the plunger also shows how much insulin is in the syringe. The needle is sterile and shouldn't touch anything before the injection. There are different sizes of syringes. Most insulin in the United States is U100, which means each cc contains 100 units of insulin. To make sure you are using the best size syringe for your insulin dose, talk to your diabetes care team. If you have special needs, such as visual or movement problems, your diabetes care team can introduce you to devices that make it easier to hold the syringe and bottle. Some people use just one type of insulin. This is called a single-dose injection. Others combine different types of insulin in one syringe. This is called a mixed-dose injection. The only difference between how to inject a mixed dose and a single dose is the way you prepare the syringe. Let's go over step by step how to prepare to inject using a needle and syringe. First, gather all of your supplies on a clean surface. This includes the syringe, alcohol swabs, a sharps container or heavy plastic bottle to put your used syringe in when you are done, and your insulin. If you need to inject a mixed dose of insulin, have both bottles ready. Wash your hands thoroughly with soap and warm water and dry them on a clean towel. To prepare a single dose of insulin, start by cleaning the top of the bottle with alcohol. If your insulin is cloudy, mix it thoroughly before use. To mix it, roll the bottle in your hands or rotate it from top to bottom. Be careful not to shake it. Turn it over and make sure there is no powder left on the bottom. If your insulin is clear, you do not have to mix it. Now, pull the plunger in the syringe back to the number of units of insulin you'll need. Inject that air into the insulin bottle. While the needle is still in the bottle, turn the bottle upside down. Make sure the needle is covered by insulin. This prevents an air bubble from getting into the syringe. An air bubble is not dangerous, but it takes up space and can cause you to measure the wrong dose. Pull the plunger back to the correct number of insulin units. If you see an air bubble, push the insulin back into the bottle and fill the syringe again. Put the syringe down. Make sure the needle doesn't touch anything. If the needle on your syringe is bent, you must discard it and start again. Now you are ready to inject. Now let's prepare a mixed dose injection using a syringe. Some insulins come pre-mixed in a single bottle. For example, 70/30 contains 70% intermediate-acting insulin and 30% rapid-acting insulin. However, sometimes you need to mix two types of insulin together in the same syringe, usually a rapid or short-acting insulin and an intermediate-acting insulin. Please note, long-acting insulin cannot be mixed. To prepare a mixed dose of insulin, you'll need to do a little math. Write down the number of units of intermediate-acting insulin you need to take. That may be 16 units. Then write down the number of units of short or rapid-acting insulin you need to take. Let's say you need 8. Add both figures together to get the total number of units you'll be injecting. In this case, 24. When you are more comfortable with this process, you can add these numbers in your head. Wipe the tops of both insulin bottles with an alcohol swab. Pull the plunger of your syringe back to the number of units of intermediate insulin you need, in this case, 16. Inject that air into the bottle of intermediate-acting insulin. Do not begin drawing the insulin yet. Instead, pull the syringe straight out. Now draw in 8 units of air and inject it into the bottle of short or rapid-acting insulin. This time, leave the needle in and turn the bottle upside down so that the insulin completely covers it. Then draw out the correct amount of insulin, 8 units. Be sure to check for an air bubble. If you see one, push the insulin back into the bottle and start over again. Now for the intermediate-acting insulin. If you are using an insulin that needs to be mixed, mix it gently but thoroughly. Do not shake it. Insert the needle into the intermediate-acting insulin bottle and turn it upside down, making sure the needle is completely covered with insulin. This will help keep an air bubble out. Carefully pull the plunger back to the total number of units you want to inject, 24 in this case. You need to be especially careful at this point. If you draw up too much insulin or see an air bubble in the syringe, you cannot push the mixture back into the bottle. You must dispose of the syringe and start over. Also, if the needle on your syringe is bent, you must discard it and start again. Now you're ready to inject. Some people who inject insulin use an insulin pen. At first glance, the insulin pen looks a lot like a writing pen, but it has a needle instead of a writing point, and an insulin cartridge rather than an ink cartridge. Though you can't mix different types of insulin and put them into an insulin pen, pens do come pre-mixed. Keep in mind that there are several different pens to choose from, and each will have its own special instructions. Work with your diabetes care team to learn how to use your pen. The following step-by-step preparation method can be used with most insulin pens. Before starting, always make sure that your pen or cartridge contains the type of insulin that has been prescribed for you. Gather your supplies. They include your pen, needle, alcohol swab, and a sharps container or heavy plastic bottle. Wash your hands with soap and warm water and dry them. Pull the outer cap of the pen off. If you're using cloudy insulin, roll the pen between your hands and tip the pen end to end to mix the insulin thoroughly. Next, wipe the rubber seal at the top of the pen with alcohol. Get the needle and take the protective paper tab off. Screw the needle onto the pen tightly. You'll notice that it is still in its protective cap. Remove the outer needle cap. Take off the inner needle cap. It is important to prime your pen before each injection to help ensure your proper dose. This means doing a trial air shot or safety shot before injecting insulin. To prime your pen, dial your pen to deliver 2 units of insulin by turning the dose knob until you see a 2 in the window. Point the pen straight up and push the injection button. You should see insulin come out of the needle tip. If you don't, prime your pen again. Now you can set your dose. To set your dose, turn the knob until your dose amount appears in the window. Now you are ready to inject your insulin.
Don't be scared. It's just a needle. Just a pinch. Just remember, it's good for you.
Whether you are using a syringe or insulin pen, insulin should be injected into fatty tissue. The recommended injection areas are the abdomen or belly, the backs of the arms, the tops or sides of the thigh, and the buttocks or rear. With most insulins, where you inject on your body can make a difference in how fast the insulin will go to work or its onset. Generally, the abdomen works fastest, followed by the backs of the arms, the top or outer thigh, and then the buttocks. Work with your diabetes care team to find the injection area that is best for you. Try to use the same area at the same time every day, but make sure you change the actual injection site each time you inject. This helps keep your skin and underlying tissues healthy. When injecting into your abdomen, make sure to stay 2 inches away from any scar tissue or your belly button. If you are about to exercise, be aware that injecting the part of your body that you are going to exercise can cause your insulin to work more quickly. For example, if you inject your leg and then go for a run, your blood glucose level may drop more quickly and go much lower than usual. So before a strenuous run, you may want to choose a different area, and you may need to eat a snack before your run. Once you have selected an injection site, wipe the skin with alcohol and wait a few seconds for it to dry. Pick up the syringe or pen and inject at a 90-degree angle. Press the syringe plunger firmly and smoothly, or firmly press the insulin pen injection button. Depending on the pen you are using, you may have to hold it for 5 to 10 seconds. Then pull the needle straight out. After taking the injection, drop the syringe or pen needle into a sharps container, which you can get at your diabetes product supplier. If you don't have a sharps container, a heavy plastic bottle with a tight-fitting lid clearly labeled that it contains medical waste will work too. In some areas, you are asked not to put filled sharps containers in your regular trash for collection. Your diabetes care team can tell you if your community has a specific place to take your sharps container when it is full.
Thank you very much. I'll talk to you soon.
New ways to take insulin are constantly being developed. Breakthroughs occur to make insulin delivery easier today and in the years to come. By practicing and working closely with your diabetes care team, taking insulin will become a valuable tool in your blood glucose management.
But once I actually injected myself, it wasn't as bad as I thought it would be.
Taking a shot is just second nature. You have to do it, so just do it and get it out the way just so you can stay healthy.